Hello everyone, this is Pranjalkar. Today we will talking about surgical diaphragm, also known as electrosurgery. Diaphragm is used high frequency alternative polarity radio wave electric current, cut or coagulate tissue during surgery. It allows for precision incision to be made with limited blood loss and is now used in nearly all surgical disciplines. Diathermy uses very high frequency current around 0.5 MHz to 3 MHz of electric current. High frequency avoid the intense muscle activity and electrocution hazards which occur if lower frequency are employed. Now let's get into the principle. It is actually a very straightforward. When high frequency electric current energy passes through body tissue, it is converted into heat, and the heat controlled carefully is what surgeon use to cut or coagulate tissue effectively. Let's move to the next slide. Depending on how the current is applied, can be diathermy can be used in four different ways. First, cutting. Here, a very high concentration of current is delivered to a fine electrode, like a needle or loop. The heat is so intense that the fluid inside the cell boils instantly, and cells burst or tear apart, and this allows surgeon to make a precise incision. Second point, coagulation. This time, the current is slower and less intense. Instead of bursting cell, it seals blood vessels. So bleeding is controlled right there on the spot. Now the third point is coagulation. This one looks different. The electrode does not touch the tissue at all. It held just above the surface. This creates a small spark or what we call an electric arc. The effect is the effect it mainly destroys the surface tissue and some stop small capillary bleeding. Now the next point is desiccation. Here the electrode is inserted directly into the tissue. The heat the heat causes water inside the cell to evaporate. The tissue essentially dry out and coagulate. Now move to the next slide. Instrument for surgery. Of course, all this happened with the specific instrument. Let's quickly look at what make up the system. First is electrosurgical unit or a generator. This is the main machine that produces high frequency alternating current. Second, active electrode. This is a fine-tipped electrode like needle or loop held by the surgeon in their handpiece. A simple button activates the current. Third, the indifferent electrode, also called the patient plate or dispersive pad. This is a large electrode placed under the patient's thighs or back. It provides a wide surface for the current to exit safely and return to the machine. Fourth, the patient. The patient is literally part of the circuit lying between the active electrode and the dispersive electrode.
This is Ayushi. Uh, I'm going to explain the working principle of surgical diathermy. It uses high frequency alternating electric currents, just 13 megahertz, avoiding muscle stimulation and electrocution results present at low frequencies like 50 Hz. This machine generates radio frequency currents via high frequency oscillator, producing continuous undamped waves for cutting, damped pulsed damped or pulsed waves for coagulation, and blended waveforms for combined effects. The next slide. Uh, this is the diagram which shows the key parts of surgical diathermy machine, which uses high frequency electrical energy to cut and seal tissue during surgery. In the next slide, uh, it starts with power supply, which produces power to the entire system. The logic board is the brain. Uh, It lets the surgeon choose the mode like cut, coagulate, and manages safety. Then we have point-to-point output board and isolator. This machine generates a high-frequency current that avoids muscle stimulation. The signal is amplified on on the power output board before it reaches the patient. It passes through the critical isolator, a safety system that prevents electrical shocks. Then the next slide we have point of point to foot switch. The surgeon activates this energy hands-free using a foot switch for precise control. Then we have then we have the electric system. It has two modes, which is monopolar and bipolar. In monopolar mode, the current flows from a small active instrument through the body to a large wave return pad. And in bipolar mode, the current only moves from fingertips of the forceps for delicate and complex flow. In slide, the next slide, we have the gesture to show the effect. The tissue resists the current, generating heat. This heat vaporizes water for cutting or its protein for coagulation. Then on the last slide, by concluding everything, finally we have modern machines which are smart. Logic board monitors the tissue and auto adjusts the power to ensure consistent results and maximum safety from start to finish.
Okay, this is Samyak and I'm going to discuss the various mathematical expressions based on which surgical diathermy works. So the first expression is about the power dissipation. This expression states that V is equal to I square R. And it can also be iterated as V square by R. When the high frequency current converts electrical energy into heat. This is basic. This is the basic principle of a resistive heating. It is used in it explains how the electrical currents produce therapeutic heating in tissues. The higher the current or resistance, the more heat is generated. We'll move to the next mathematical expression. This expression states it gives us information about the current density relation. J is equals to sigma E. Here, J represents current density, and sigma represents applied electric field. Sorry, sigma represents electrical conductivity, and E represents applied electric field. Now, why is it used in diathermy? It is used in diathermy to show selective heating of tissue. Muscle heat more than fat because they conduct better. So, next equation. Next equation is about the power density. PD represents power density, and again sigma E square. The energy absorbed per unit of volume of tissue depends on conductivity and electrical field strength. This is also known as SAR, or specific absorption rate, in biomedical engineering. It is used in diathermy as it helps us in tissue absorbs, ensuring effective therapy while avoiding overheating. Safety standards for diathermy machines are based on R value. Next equation, skin depth, penetration depth of EM waves. Basically, delta is equals to under root 2 omega mu omega mu sigma, where omega is equals to skin in depth differential before it decays near the surface. Why is it used in diathermy? As it explains why short diathermy, that is 27 millihertz, penetrates deeper, uh, useful for muscles and joints, while microwave diathermy is on to the next equation. This equation tells us about the temperature rise in tissue. That is delta T, that is change in temperature, is equal to ED dot T by rho C. Rho here represents the tissue density. C is heating capacity. It is used in diathermy because it ensures controlled heating. Therapists use this principle to avoid burns and maintain therapeutic temperature.
Aditi Shindakar, and I will be presenting on practical application of surgical diathermy. As seen earlier, it is a technique that uses high-frequency current to cut, coagulate, and ambient tissues with high precision. It is widely used because it reduces bleeding, minimizes tissue damage, and improves surgical outcomes. Now we will see its core applications. It mainly has four core applications. Firstly, precise bleeding. It allows surgeon to make clean incisions with minimal trauma. Second, is hemostasis. It seals small blood vessels, reducing blood loss and keeping the surgical area clear. Third, tissue destruction and ablations. This is used for removal of warts, tumors, and other abnormal parts. And finally, hyperthermia therapy. Diathermy can also generate heat to treat neoplasms and for treatment of physiotherapy, which helps with pain relief and relief. Now we will see the clinical application across various specialties. First, in ophthalmology, it uses for safety in eye surgeries for cutting and coagulation inside a fluid environment. In neurosurgery, it helps seal tiny blood vessels without damaging the sensitive brain and spinal tissues. In endoscopy and gastroenterology, it is used for procedures like polyp removal, tissue recreation, and blood control in the hollow tissues. In gynecology, it applies during hysterectomy, ovarian cyst removal, and endometrial ablation. And in plastic and reconstructional surgery, suction diathermy allows precise cosmetic procedures which reduces bleeding. Thank you.
Recent advancement in surgical diathermy. AI-enabled diathermy. Modern diathermy machines use artificial intelligence to automatically adjust energy levels for precise cutting and coagulations. This machine helps to minimize thermal injury and improve safety during complex surgeries. Smart safety features. Features such as continuous impedance monitoring and audible alarm helps to prevent accidental burns and injury during surgery. Wireless and mobile devices. Diathermy machines are becoming wireless and portable, making them easier to use in different settings and improving workflow. Nanotechnology. Biocompatible coating and electrode reduce tissue sticking and extend tool life. Now we move on to the quizzes. Short quiz. What does fulguration refers to? The correct answer is B. Superficial tissue destruction by electric arc. Second, in monopolar mode, the return path for current is through. The correct answer is B. Patient's body to a grounding pad. Question 3. Specific absorption rate uh, in diathermy is used to calculate. The correct answer is B. Absorb power per tissue volume. Fourth question. What is the main safety feature in modern diathermy machines? The correct answer is A. Written electrode contact monitoring. Last question, fifth. Which tissue heats up more during diathermy? The correct answer is B. Muscles. Thank you.